So my name's Melanie Casey. I work for Ochsner in New Orleans and also with University of Queensland in Queensland, Australia. So this is our presentation on Meet the Leaders on 4/30/2025. Tonight we have Dr. Amedee, we have Dr. Marlon Joseph, and we have Isabel Anderson. She's our OMSA president and a current fourth year. Joining us also is Scott Peters, as well as Kathy and Pete. They will be monitoring the chat room as well as the Q&As. So if you have any questions, just pop them in the chat and we'll be sure to get to those at the end. All right, so I will hand it over to Dr. Amedee, who's going to start with some of the history of the school and go from there. Dr. Amedee.
Thank you very much, Melanie. I appreciate if you could give the first slide up. My personal journey into medicine actually began when I started undergraduate school, and I went in as a music major. I had delusions of grandeur that I was going to be a great conductor or composer one day. And at the same time, I was taking all the music liberal arts curriculum. I was taking equal amount of chemistry and biology and physics classes. And after my sophomore year, my guidance counselor said, you know, you're actually doing better in all these science courses. I'm not quite sure why you're doing this, but you're actually doing better in those science courses.
Dr. Amedee?
Yep.
Oh, there you are. Okay.
Still here. Have you thought about a career in medicine? And I said, no, I hadn't. And he says, well, think about a career in healthcare. And it was a very general statement. It wasn't think about being a physician, but lo and behold, did a lot of soul searching and realized I wasn't going to make it to Carnegie Hall to conduct some great orchestra. But very quickly sort of moved a little bit into the mode of preparing to take the MCAT examination. Found myself applying to medical school and found myself there as soon as I graduated from undergraduate school. And pretty much the rest is history. And I have to say that I applied to medical school with the intention of being a primary care physician, a family medicine doctor, because that's all I knew growing up. I mean, my doctor was a family medicine doctor. He birthed me. He would have taken my tonsils out if my mom wished to donate them to science. And he pretty much gave me my last physical before I went to medical school and said, Ron, this is it. You're going to find somebody else after all of this. But I fell in love with head and neck anatomy and neurosciences and tried to figure out as an early medical student how I could marry those to a career in medicine. And neurosurgery seemed too long and arduous a residency. And having worked with a lot of neurosurgeons in my current capacity and my current level of training, I think they're a little out there to begin with. Apologize to anybody that has family members that are in neurosurgery, but it takes a unique individual, and I didn't see myself as one. I thought about neurology, but I really wanted to be involved in doing some procedural things more than was offered in the specialty of neurology. And I rotated on ENT kind of by accident as part of my surgery rotation in the early third year of medical school, and absolutely loved it. And that changed my trajectory because I saw in otolaryngology that I could be taking care of the baby, I could be taking care of the parent, I could be taking care of the grandparents, which was something that drew me to family medicine and primary care at the very beginning. And the rest is kind of history. As of the 19th of next month, it'll be 44 years in the practice. I currently have the great privilege of serving as the director of the Ochsner Clinical School in partnership with the University of Queensland. I have spent pretty much all of my professional life in otolaryngology and in the study of otology and neurotology, working from an academic perspective as a program director, as a teacher of medical students, as a chair of clinical departments, and now in my current role as Dean of Medical Education at Ochsner Health. If you could take me to the next slide. Thank you, Melanie. Our partnership actually began in 2007, shortly after I arrived at Ochsner. And Ochsner at that time in 2007 was looking for a partnership to establish more robust research enterprise with. And as it turns out, we got a call from at that time, the CEO of the AAMC, the American Association for Medical Colleges, saying, I have a partner, but they're not in the United States. and they're all the way down in Queensland, Australia, and it happened to be UQ. And what UQ was looking for in a partnership with a U.S. entity was the opportunity for more clinical collaboration, particularly from an educational standpoint for their learners. There's about 500 students in each of the medical school classes in Brisbane, and about 100 of those are carved out for our partnership with the University of Queensland and the Ochsner Health System. And our first class was taken in 2009, and we graduated our first class in 2012. And since that time, we've graduated 12 consecutive classes with over 1,000 graduating alumni of this particular program. We now have alumni in all 50 states of the union, training and or practicing now. We've been in existence long enough to see people come out the other end. And by the way, if you pursue this program, you will also be, with your graduation certificate, be eligible to practice in Australia, which about 8 to 10% of each of our graduating classes decides to do for love of country or love of somebody else. Next slide. Compare the University of Queensland and Ochsner Health just briefly. They are both located in river cities. The University of Queensland is in Brisbane, which will be the site of the Summer Olympics in 2032. And New Orleans is on the Mississippi River, and it's the home to Ochsner Health System. First, the University of Queensland is a top 50 global university. I think the current ranking is somewhere around 25 in that list of very elite universities. It's composed of 5 faculties, and if you want to know what a faculty is, there's a faculty of health, medicine, and behavioral sciences, which is where the medical school is located in Brisbane. There's also a faculty around law, business, mining, and also education. And it's a real research powerhouse with billions of dollars in extramural research funding. The University of Queensland partnered with Ochsner Health mainly at the time that we were expanding, and at the current state, we're at 46 hospitals and 370 health centers that are located throughout the Gulf South Louisiana, which also includes Mississippi, the Florida Panhandle, and now North Carolina. We have 4,700 employed and affiliated physicians that work for Ochsner Health, with over 40,000 plus employees in Ochsner Health System, representing on the physician end 90 plus medical and surgical specialties. And for the past decade, Ochsner Health has been voted by U.S. News and World Report as the #1 hospital to provide care in the state of Louisiana. Next slide, Melanie. How do our students perform? It probably should be a very important metric that all of you that are on this webinar should be considering about your medical school choice. And here I'm going to give you the history of how we have performed in the match, the NRMP, the National Residency Matching process, since 2016. And you can see how the number of positions offered in the match has increased from 2016 to the current year, where we just had match in the week of March the 16th of 2025, with over 43,000 positions being offered. And I'll take you to that third column where the UQ-Ochsner graduates have consistently performed at or above what we consider the mean, and the mean is defined by Ochsner is the number for MD seniors in the United States, which historically has been somewhere between 93.5 and 94%. You can see the UQ-Ochsner cohort has been somewhere from 93 to 99%. Our current cumulative average over this time span is at 96%. And you can see how that compares to students that come out of osteopathic schools and also students that are coming from non-US IMG entities. Next slide, please. So how are doctors performing in their workplace post-graduation from the program? Next slide. And we have actually contacted every program director in the United States that has taken one of our graduates into their program. And we usually send them an evaluation to complete toward the end of their internship year. And since 2012, we've had a 73% response rate, which is pretty good for any survey you send out. And what I'm happy to report is cumulatively 88% of our graduates are performing in the top half of their intern class. You can see that almost 40% are in the first quartile and a very small percentage that are in the bottom half of their intern class. I think that's an important thing to keep in mind, simply from the standpoint that our alumni in this top half of their intern classes go on to become chief residents of their programs in large numbers. We also have seen many of our graduates beyond residency secure highly competitive fellowship programs and have come out on the other end as super specialists or masters in the practice of medicine. And I think it's important also to let you know that when we enter the matching process each year, we get calls from program directors and chairs of various departments all throughout the United States now that ask us, how many more of your graduates can you send us, like the kid we took last year or 3 years ago or 2 years ago? Basically, the program has sold itself and has really paved the way for our graduates to find their way into highly competitive residency programs. And now what I'd like to do, I'll turn over the next part of the presentation to Dr. Joseph, my colleague in crime at the clinical school. Dr. Joseph, take it over, please. Next slide.
Great. Thank you so much, Dr. Amedee. And it was really great to hear about your journey in medicine. And I do think that you did achieve your goal of becoming a director of a symphony, because the symphony that we have here at University of Queensland, Ochsner, I think is quite well done. So you still get to be a conductor.
Thank you very much for that comment. I appreciate it.
Indeed. So, so a little bit of a comment about my journey into medicine. I am a primary care physician here at Ochsner Health Center. I've been on staff since 2018, and I am also faculty of the University of Queensland Ochsner Clinical School. So I decided that I was going to become a physician at the young age of 11 years old, after being inspired by several of my family members and their journeys into medicine. So I kind of took that ball and ran with it, really had a love of the sciences from a very early age, as many of you on this webinar, I'm sure, also have a passion for, and that continued into my undergraduate career and then subsequently into my medical school career, where I then decided to become a primary care physician was when I had that realization that I really loved taking care of the scope of pathology from newborns all the way up into geriatric medicine. And I really enjoyed having the connection I had with my families that I would see, and I knew that I would be able to take good care of both sides of the age spectrum. So I continued on into residency in internal medicine and pediatrics, where I got really good training in both areas to become board certified in both of those fields. And then after that, after residency, I moved on to practice in the Boston area for a few years for my first job after residency. And I'm from the South, originally from New York, but then my family moved to Florida during the adolescent years. So we always knew as a family that we would be coming down home to the South, and we made a home in New Orleans about 7 years ago, and have really laid down roots and not looked back. I work here on the West Bank of Louisiana in particular, which is a great place, great culture, great food, great people. And it's really a privilege to take care of a truly diverse population here in New Orleans, where every day I feel that I really am living out my dream of being able to be a physician and to practice medicine in a way that is very fulfilling. So a few comments about my other roles at the medical school. So I've been the general practice clerkship director for the past few years here at Ochsner. And in that role, I work particularly with the fourth year medical students who come through every year. So I get to touch base with each and every student before they end their medical journey here at Ochsner. And it's a great fulfilling experience for me because not only do we get to do a lot of things to discuss preventative medicine, to discuss how working as a physician really is impacted by general practice, by the practice of primary care. We get really to have a capstone experience. So students feel very confident coming out of our training in medical school that they're able to not only get on to the next level in residency, but they're able to, answer those questions you get from your family members about things that might come along. Since as doctors, we're teachers first and foremost of our patients and our friends and family. So in that role, I do a lot of clinical teaching. I do clinical teaching in my own personal clinic as well as didactic lectures. And I also get to interact with the students as we pursue research projects and pursue other academic endeavors. So as a prospective student for University of Queensland Ochsner Clinical School, you will have a really robust educational experience. You will have motivated, very enthusiastic faculty like myself who are very excited to interact with medical students, to teach medical students, and to really see your dreams and journey in medicine be fulfilled. And that's something that I really wanted to share with you all today in terms of how my practice in particular and my role in academics may impact your journey. So with that being said, I will hand the baton to Isabel Anderson, who is our OMSA president, the Ochsner Medical Student Association president.
Hi, super happy to be here. Would you mind? Okay, there we go. Hello. Um, so I'm a fourth year medical student. I guess my journey to medicine, I'd always kind of been interested from a young age. I actually studied public health at Tulane University and went on to get my master's in public health. Because I think from about middle school, high school period of time, I got kind of interested in international relations and did Model UN and realized there's a lot of health disparities worldwide in the US and abroad, and did some shadowing experiences internationally with public health workers, fell in love with the idea of public health with medicine, the idea of being able to prevent people from getting sick in the first place. So went to Tulane for that, was pre-med and did public health, and actually worked at Ochsner as an emergency department technician during my senior year and my graduate year. And I really loved it. I actually met a lot of the UQ-Ochsner students when they were rotating through their emergency rotations, and they just seemed really happy, and they had a lot of great things to say about Australia. And the physicians in the emergency department, whenever I mentioned that I was pre-med and that I was interested in or that I was applying, they would take the extra time to show me a cool image or explain why they were prescribing a medication. And so I felt very much like it was a teaching hospital and just a good place to be. And then also was attracted to Australia because of my interest in international health, wanted to see what it was like in with different healthcare system, and just be able to travel and kind of expand my horizons. I'm originally from the DC area. My parents live outside Boston now, but I have lived in New Orleans for a long time, so it's almost like a second home to me. It's a great city if you've never been. Lots of culture, great food, and if you're interested in stuff like health equity and social justice, a great place to be for that, which is one of the reasons I was attracted to go to Tulane. I'm planning on applying for obstetrics and gynecology, which fingers crossed, very excited. I guess that I kind of knew that I wanted something that I could have a strong health equity focus in. Came in sort of thinking maybe maternal child health, because I had done a lot of that in my master's, but really fell in love with it my third year while rotating. And actually, like a personal connection is my mom actually got really sick during her pregnancy with me. And the reason I'm here is due to a maternal fetal medicine specialist. So that's sort of what I'm interested in pursuing down the line. And then I do a lot of research at Ochsner, particularly around social determinants of health and health equity. So I've done one with I have an ongoing one with students trying to increase and improve screening of social determinants of health and kind of incorporating it into physician workflow and having the students kind of lead that initiative. Also work on a project involving Lyft, free Lyft ride to primary care appointments and kind of looking at how that has changed healthcare outcomes in that population. And then just starting to work on one that involves home visits in New Orleans postnatally. Yeah, I'm the OMSA president. I'm also involved in some other organizations like the OB-GYN interest group, the pediatric interest group, Gold Humanism Honor Society member. Gold Humanism is an honor society basically honoring humanism and the human touch of medicine. So I was super honored to be selected to be part of that. And then I do a lot of volunteering in New Orleans and internationally. I did the Panama elective during my 3rd and 4th year, so traveled to Bocas del Toro, Panama, which is the northeast kind of corner near Costa Rica. Volunteered with Floating Doctors, an amazing organization that provides healthcare to rural and indigenous communities that do not have any healthcare. And absolutely loved it. And then do a lot of volunteering with unhoused individuals in New Orleans, providing healthcare to them. So yeah, I'm happy to speak or answer any questions about my experience in New Orleans, my time at Ochsner, my time at UQ. I've absolutely loved every minute of it. I wouldn't change it for the world. Actually currently on my return rotation in Australia right now. So as a 4th year, you go back for one of your rotations, and it's been great to come back and see all of my friends here. And yeah, so happy to answer any questions. Thanks for letting me speak.
And I think we just have one more quick slide for you just to go over some of what OMSA is and student opportunities.
Oh, sure. Yeah. So OMSA is the Ochsner Medical Student Association. So basically, from the start of med school, I would say the main role of OMSA is peer support. So when you're an incoming 1st year, the 2nd year OMSA board, so we kind of have a phase 1 OMSA board, which is the year 1 and 2. That's led by the 2nd years in Australia, and then the larger OMSA, which is led by me, which includes that phase 1, but we also do stuff phase 2 in New Orleans. So when you're a 2nd year, or when you're a 1st year and you come in, you can sign up to have a 2nd year mentor, and that person will basically help guide you through the beginning of med school, give you study tips, advice about if you haven't found an apartment yet, where to live, kind of just research, any questions. I've become really good friends with my mentees and was really close friends with my mentor. She was amazing, and still keep in contact with all of them. And then kind of, yeah, continued support throughout 1st and 2nd year with, they run peer tutorials, so study groups, which help the 2nd year study for step 1. And the 1st years can learn the content. And then just things like that, resource sharing for exam prep for step 1. We do panels with 3rd years sharing their study tips for step 1 with 2nd years. And then kind of also social events. So there's always a welcome kind of cocktail party for everyone to meet at the beginning of 1st year. For 3rd and 4th year, we have a fall ball, we have field day, which is really fun, and some other events. So mainly we're just here to support students, and we also advocate for any concerns with student affairs. We meet regularly with Dr. Denton, who's the head of student affairs, and other admin to voice any student concerns. Then there's the student ambassadors, which are basically people that share their experiences about the program to prospective students. So there's a web page that has a list of all of us, and basically you can read our little bios, and if you're interested in talking to someone more, you can reach out to the school and they'll connect you with one of us. And then we have several student interest groups, pretty much any specialty that you can think of. We have a student interest group. We also have clubs for just like fun things, like we have a pickleball club. I think we have a tennis club. Yeah, so super fun in New Orleans, just do fun things outside of rotations, and on top of that, community involvement. So we have a Habitat for Humanity group. A lot of our student interest groups get involved in like organizations that are related to their specialty of like interest. And then what else? Elective rotations. So a lot of people will do an elective like I did kind of in between third and fourth year, and I was able to go to Panama for that. Some people will go home for the holidays and do an elective back at home. And then throughout fourth year, you have the option to do an elective either at Ochsner. You can also do LSU and Tulane very easily within New Orleans, and then you can apply and pretty easily do an elective at any place that you want to go to. And then, yeah, international opportunities. I think the biggest one is the Panama elective. There's also an elective in Colombia, I believe, that you can do. And then we're working on creating some more. There used to be a trip to Haiti that Dr. Laborde, who's the head of community health, used to run, but due to the political situation there right now, that's no longer running. But we're actively working on making even more international opportunities. I think there's discussion of a potential Bolivia elective as well. So yeah.
Perfect. Thank you so much. I'm just going to do a quick overview of the entry requirements, since I see there were a lot of questions in the chat about our entry requirements. And then you can always go to our website for more information, and we'll have that at the end as well. So we require a 504 on the MCAT. That 504 is what allows your application to progress. You can submit without an MCAT application or an MCAT score, but you will have to like open up a Word document, put the date you're planning on taking the MCAT or even a season, so that way UQ can follow up with you. But that 504 is what lets your application progress. If you don't have the 504, because you just haven't achieved that yet, you can just keep retaking it, and we'll roll your application over for the next cycle as long as you want to. We do take an A or B average because UQ does move our 4.0 scale to their 7.0 scale, and that is A or B average in the last degree obtained. So that would be in like Isabel's case, that would be in her master's degree. And only her master's degree that we would look at. We wouldn't look at any post-bac or her bachelor's because that would be the most recent degree obtained. And that is cumulative for all courses. There are 2 prerequisites, which are cell bio and physiology. UQ does have them available online to see if your school meets the requirements for them. If not, UQ will send them to you in modular format online, and that will, once those are completed, that will move your application and progress it forward. Then 50% of what determines eligibility into our program is going to be the multi-mini interview. It's going to be 8 10-minute interviews via Zoom, all in one day, back to back, and they, that will determine what if we extend an offer. And then our calendar year does run a little different because it is Australia. So we do start in January and we run to about October, beginning of November. So we do have 2 applications open, which is January 2026 and January 2027. So those would be the start dates. We are currently filling for the January 2026 cohort. Once that is full, we will then roll over anybody that would like to be rolled over into 2027, and we will open 2028. So if you are looking to apply soon for the 2028 year, that should be opening later this year. There are week-long breaks. Australia is known for their work-life balance. So that's always nice. And then be mindful of the seasons in Australia because they are flipped. So that is why they run like November to January because of summer down there. We do a holistic application process. It's a free in-house application. It's on our website. We don't require any letters of recommendation, no personal statement, no clinic experience, no research experience, none of that. So it's a free online application. You can just apply and, see if we can get your application to progress and if we can offer you a placement at our school. And then this is the financial obligation. It is $67,000 a year. We haven't raised our tuition, I believe, in the last 5 years. And it is on par with US MD programs. And then this is my favorite, the Ochsner Physician Scholars Program. And I saw somebody had mentioned psychiatry specifically in the chat. If you're interested in these 4 specialties, and you are interested in these 4 specialties, Ochsner is willing to pay years 3 and 4 of medical school up front. They only ask that you return to Ochsner, and that could be any Ochsner facility across the Gulf South and the Carolinas now. If you have to work for us for 5 years after residency, but after residency, you have a guaranteed job. And you know where you're going roughly, because you had made that commitment early on in your career. And then if you need any information, always go to the website. Like Isabel was saying, you can choose to talk with a current 4th year student, our student ambassadors, they're there, or you can schedule to talk with me or my coworker, Sue. We would be happy to do one-on-ones. Chat with current students. That's also where it'll show any upcoming events. We have plenty of student stories. We also have previous webinars available to watch that are very informative, as well as all the admissions information. And then I think we're going to do some Q&A real quick, and I'm going to leave the thank you on our website up. Actually, I think I'll leave this one up. Kathy or Scott, did you want to start with Q&A?
We've been answering Q&A.
Okay. Are there any questions that we want to ask now that I didn't cover that was been answered? Oh. Would someone like to touch on research opportunities for students in Brisbane and NOLA and New Orleans?
Sure, I can touch on that unless someone else wants to. Okay, so UQ is a major like global research university, so there is a lot of opportunities your 1st and 2nd year. There is like a specific staff member that is sort of like the liaison for medical students in research, and so you're able to contact her and get involved. That way you can also reach out to any labs or particular faculty that might seem like they have research that aligns with your interests via email. I will say most people get more involved with research 3rd and 4th year. In our OMSA newsletters, which we send out weekly, we post research opportunities. We post research opportunities weekly. We have a dedicated staff member at Ochsner who basically is involved with research and medical students. And so she will actually run webinars. I think those are at least once a month about different research topics, like how to submit to IRB, how to use REDCap or other data pools, how to write a good research proposal. And those are completely free, and she gets staff members. So Ochsner has like a whole research department of statisticians, EPIC specialists, data informatics people that can help you. So when you start a project, you're actually able to fill out a form and request help from that department, and you'll be connected with someone, which has just been amazing for the projects that I've been involved in. But those people will often lead the webinars, which are very informative. And then if you can't make those webinars, they are recorded. So lots and lots of opportunities for research at Ochsner and UQ. So yeah, happy to answer any additional questions. I think that covered most of it, though, hopefully.
Isabel, I think it's important to mention that there has been a slight refresh in the University of Queensland Medical School curriculum, which we teach in New Orleans. And starting this year, in the third year, once you arrive in New Orleans, a component of the curriculum is that you're engaged in a year-long research project. And it's team-based, and the teams are assigned around specialty interests that you may have. And right now we have almost 100 third-year students that are involved in research activities longitudinally throughout this whole year, which will be excellent on their CVs. There will be excellent information to talk about at the time of interviewing for a residency. They'll look great on a CV once you complete your residency and are thinking about what you're going to do after that, whether it be a fellowship or it be entering clinical practice. So a lot of opportunities, as a matter of fact, as Isabel has said, and it's now been actually firmly planted in the third year of the medical school curriculum, both here in New Orleans and in Brisbane.
And I see a question to add on to Dr. Amedee's comments about combined programs. So there are several MD, PhD students in our cohort, and those requirements, of course, involve getting a project accepted into the MD, PhD track, and there are several other tracks that are possible for additional degrees, which we would have students apply for separately once they've matriculated.
And that
Thank you,
PhD
Dr.
track, Marlon, actually takes place in Brisbane. So you're adding on time to those first 2 years that you're in Brisbane. That's the research track. You will complete your PhD while you're in Brisbane. And once you complete that, you will come to New Orleans and complete your last 2 years of clinical experience and then graduate.
Great. Yeah.
And those are
That's
all
right.
funded with a stipend.
Yes, there's also an MB addition, that MBA that can be added. That is through Loyola University here in New Orleans. We have partnered with them in many educational activities. One is around offering an MD-specific MBA program. We have now graduated 3 years of students from that particular program. Usually it pertains to anywhere from 3 to 4 students per year that are interested. There are application requirements to participate in that because you're taking upon yourself a great amount of study and work in project building. At the same time, you're trying to acquire your medical degree. So the students, a lot apply, but very few are chosen, just those that we believe are capable of meeting all the demands of both of those particular curriculums.
Awesome. I'm gonna see if there's a few more questions. If anybody has questions, can you pop them in the chat? And then I guess while we wait for a few more questions, I'm gonna ask our 3 panelists the thing that makes you most proud to be associated with UQ-Ochsner. I'll start with you, Dr. Amedee.
Well, it's actually something very near and dear to my heart, and it's actually being more than just a spectator, but actively participating in seeing medical students join the continuum of medical education, progressing from medical school into residency, completing their residency and entering into practice, that whole continuum is something that's a beautiful thing for me to behold, and to be participatory in that adventure from year one of medical school to the time you walk across the stage in New Orleans and receive your MD degree. I have to tell you, your parents and your loved ones are going to be very proud in the audience on that particular day when it occurs. But they have to stand in line behind me because I'm equally proud of each and every one of our graduates as they leave us to move on to bigger and better things.
Thank you, Dr. Joseph.
Certainly. So I'll say in short, it's our students, because there are 2 times of year that get me really excited that I am part of the faculty for UQ-Ochsner, and one is the white coat ceremony when we have our 3rd-year students return home triumphantly from Brisbane to start their clinical years, and you see the enthusiasm and the excitement on the students' faces, and you know that they're really ready and hungry to finish out their last 2 years of training. And then the second time of year would be graduation, when you get to see the family, the friends, all the people, the support group that has helped each of our students get to this point in their careers. And being a part of that celebration is great, because we know that it's the start of a journey that just continues. And I really enjoy being in touch with our students after they've graduated the program, especially since we just had match day, as others had mentioned last month. And I know I'll be able to kind of watch others, watch their students' careers as they progress as physicians.
Thank you, Dr. Joseph. Isabel, what makes you proud to be UQ-Ochsner?
I would say I feel like the UQ-Ochsner students are very resilient and globally minded individuals. I think some of the smartest people I've ever met are UQ-Ochsner grads, but also just incredibly reflective and kind people as well. I think having a global health kind of mindset is really important these days in medicine. And our graduates certainly get that through living in Brisbane for 2 years. Yeah, I would say I am very proud to be part of this program. I feel like there's been so many opportunities for me through this program. And yeah, just I feel like every year I'm just more and more impressed by my colleagues, by the program, by the places that we're matching into, by the research that we're doing, the volunteer contributions that we're making to the community. So I would say holistically, we are a really great program. And yeah, I wouldn't have traded it for the world.
Awesome. Thank you so much. I think that's it for the evening, for the webinar. If anybody has any questions or wants to talk to a UQ student or schedule some time with me or my coworker Sue, who unfortunately couldn't make it this evening, just let us know. You can schedule that on the website, super easy, or send an email here and we'll reach out. Does anyone else have any closing statements?
I just want to thank everybody for joining. I really appreciate your time and your interest in our very unique program, which now is in the process of establishing a very incredibly positive trajectory of our particular program. I see a lot of questions all around match, and is the IMG status going to affect my chances in residency? Absolutely not. It is not going to affect your chances at all, and licensing is not going to be an issue either. You're a U.S. citizen training in this particular program. You will always be eligible with the diploma from the University of Queensland and Ochsner Health to obtain licensing in any of the states.
Awesome. Well, thank you so much, everybody, for joining. Thank you to our leaders for taking the evening and spending the time with our prospective students. And thank you all so much. If you have any questions, here's the website and an email. And thank you guys so much. I really appreciate our leaders taking the time, Isabel taking the time out of your guys' busy day, and really just being amazing. So thank you all so much and have a great evening.
Thanks, everybody.
Have a good night, everyone.